This is NDTV, and you're watching Classics.
When we talk of infrastructure in the context of economic reform, often what gets forgotten is that it isn't just about physical infrastructure, but about soft infrastructure that we need to talk. The pillars, the two pillars of soft infrastructure are education and healthcare. In this episode, in this special season of India Inc. on economic reforms, I traveled to Chennai to talk to Dr. Pratap Reddy about healthcare, what we can do about it, and the mess that exists. A mess so big that 80% of Indians rely on private healthcare in a country in which 30% of the population lives on less than $1 a day. We have a health crisis. If you were health minister, what would you do?
Address the issue saying that if I have to create health for all, I need not just hospital beds.
You need training institutes.
I need training institutes. We'll train out healthcare institutions. We'll bring out enough number of doctors.
Why aren't there enough yet? What is the problem with setting up training institutions?
It is, unfortunately, it is regulation. The first regulation I'm telling you saying, you can't start a hospital if you are not a charitable institution. I mean, I don't see why it should apply only for healthcare institutions, that only charitable institutions can start. We should say anybody who comes under the regulations. I must regulate saying the quality of doctors you produce should be, certifiable on a national level.
At independence, India set up a massive social welfare state with huge government hospitals at the top of the structure in big cities, smaller ones in state capitals, and health centers at the district and village level. It was an ambitious plan that never really worked. Today, more than 80% of Indians rely on private healthcare, despite 30% of our population living on less than $1 a day.
Most of the times we are trying to fix that day's problem. Whatever it is, even in infrastructure, we are not thinking this is what's needed in the next 5 years, this is what's needed in the next 15 years and 25 years. So this is what is needed in healthcare. We need to realize we are not just short of this many healthcare professions today. What do we need? The total need, what we need in 5 years, 10 years, 25 years time, and build
so you're saying
the
there's
institutes
no...
to that level. What I'm just saying, if I am a Minister of Health, I would act as a facilitator. I would act as a facilitator so that there are enough number of educational institutions which will train the entire healthcare people, which again is not ordinary number. Today we have less than 4 million people working in healthcare. The potential is that we can take this to 30 million. I will feel very happy that I have provided employment potential for so many millions of people.
The crisis in healthcare was recognized more than 20 years ago when Rajiv Gandhi was Prime Minister. He sensed that things were going wrong and tried to rectify them.
I wrote only 5 lines to him. I wish I had done a BD factory or a beer factory instead of healthcare project, because if I have to live up to the Prime Minister's vision for 21st century, healthcare has to live up to his vision, I need 1, 2, 3. The first thing I said, declare healthcare as an important priority sector, and then allow them to access funds like any other trade or industry. Believe me, he was also the finance minister at that time. In 3 weeks, he enacted in the parliament saying hospitals are eligible like any other trade or industry. Today, if you see an ultrasound machine in a village, the credit goes to him. Because of that, the institutions, the banks, the financial institutions have now given some few 100,000 loans.
Then what went wrong? Why has nothing happened? We still have the worst healthcare system in the world.
Whatever it is, if you pass one legislation, one thing today, it cannot solve all issues. What he solved was an access mechanism so that
you
more
could
and
get
more
funds.
people funds. Today it's happened. As I told you, 200,000.
All right, we've got that. We've got
yeah.
funds.
Yeah.
But we don't have insurance. Less
Yeah.
than
Again-
1% of the
Again,
population.
can I say that
Yeah.
again insurance credit should go to him? When
But
I
this
say,
hasn't happened.
when I told him, Prime Minister, you can have great hospitals in the country, nobody thinks of their, they think when a child is born, they put the money for their wedding and their school and everything else, but they never think of, health, sickness for them or for their family. We need to create a mechanism where they put in and it comes to them when it is needed, and access to good health care. So he immediately said, let's put 10,000 rupees given paid will be exempt from income tax. Unfortunately, bureaucracy then said, this will be only to GIC and subsidiaries. If you pay 10,000 rupees, it's exempt from tax. Suppose they have let that loose, it would have been like US. There would have been 1,000 organizations which would have come up, which would have served the purpose like managed care, PPPs,